First of all, I will thank the organization committee for inviting me. My presentation will be about the relationship of inguinal hernia and genetic disorders. In pediatric surgery outpatient clinics, we sometimes see families where indirect inguinal hernias appearance across generation from grandpas to grandkids. This makes us wonder, could there be an inherited component maybe which complies genetic and environmental factors? There is science backing this up. For example, we know hernias are linked to some connective tissue disorders. Some of the key genes being studied include GATA6 and TBX3, which are transcription factors involved in embryologic development, especially in the etiology of inguinal hernia. Genetic research on hernias open doors to novel therapies like strengthening weak fascia tissues, precision care, earlier diagnosis, prevention, and tailored treatment for each subtype. Smarter prevention, identifying high-risk patients before hernias even occur. In children, processus vaginalis has a central position to common inguinal pathologies. Variations in the obliteration of the embryologic tissue lead to distinct clinical presentations. According to the comprehensive literature, GATA6 may control processus vaginalis closure by regulating smooth muscle cell death. Similarly, TBX3 appear crucial proper inguinal ring formation. We suspect that mutation in GATA6 and TBX3 genes, particularly in their promoter areas, could be responsible for failed processus vaginalis closure and subsequent inguinal hernia formation. And we looked at GATA6 and TBX expression levels in two fresh tissue types, hernia sacs from inguinal hernia patients and prosecute samples from healthy controls. There aren't any children's studies published in this issue so far. This was a prospective controlled study conducted in our hospital, specifically through the pediatric surgery and medical genetics departments. We ran the study from January to October 2020 with proper ethical approval and patient consent. We collected all the standard data, demographics, test results, surgical techniques, and complications before starting. We did power analysis to determine our sample size and use Mann-Whitney U test for statistics. We have two groups. Children who had undergone abdominal inguinal surgery and were diagnosed with genetic disorders from both groups in our study. Blood samples were collected from all groups for DNA analysis. 1 millimeter samples of the patient's processus vaginalis were excised in the course of indirect inguinal hernia surgeries. And 1 millimeter prepuce tissue were obtained from healthy male children who were brought to our hospital for ritual circumcision. For the isolation from fresh tissue samples, we followed the kit instructions. Then we analyzed gene expressions levels with real-time PCR. DNA isolation was performed in accordance with the protocol of the kit used, allelic discrimination. DNA sequences variance was also performed for GATA6 and TBX3. Most of the patients had right inguinal hernia, and the mean ages of control and patients groups are similar. Our results showed an increased GATA6 expressions, but a notable decrease in TBX3 in the patient group. The DNA sequence variants were looked, and 2 for GATA6 and 1 for TBX3 didn't show any major differentiation between the groups. The process vaginalis is a distinct tissue with unique embryological development and histopathological features. Furthermore, creating a control group for such a study poses significant ethical challenges. Despite the differences in the embryologic origins of the process vaginalis and foreskin, their developmental process may have governed by overlapping genetic and molecular signaling pathways. In the light of the literature review, we consider that the foreskin could be evaluated for comparison with patent processus vaginalis. Daniel et al. Show that smooth muscle contractions around the processus vaginalis helps pull the testicle down. After descent, apoptosis-programmed cell death in these muscles seals the processus vaginalis shut. If apoptosis fails, the processus vaginalis stays open, creating a direct path for the hernia form. The theory also touches other inguinoscrotal pathologies, such as undescended testis and hydrocele. While Hudson et al. Focused on the gubernaculum's role in the descent of testis, they didn't explore how smooth muscle apoptosis contributes to processus vaginalis closure. A key piece of the puzzle, gubernaculum is the primary driver of the testicular descent, acting like a guide wire. The focus here on the processus vaginalis observation rather than apoptosis. In the studies of adults with inguinal hernias and lobe cells tests, GATA6 has been connected to both hernias and apoptosis with TGF-beta and WNT signal pathways. Just like this. Although increased TBX expression has been reported to suppress apoptosis, this effect has been shown to depend on the mRNA quality in the relevant environment in our view. This likely explains the low TBX3 expression observed in the patient processus vaginalis or hernia sacs in our study. Study limitations include non-ideal controls, limited sample size, and male-only participants. Based on the findings, it can be conducted that the pathways impacted by transcription factors like GATA6 and TBX3, which play a significant role in the mechanism of smooth muscle cells, the differentiation and apoptosis in the development of hernia, told the key to understanding the etiology. These findings lead us to believe that the defect in the processus vaginalis ability to close may genetically based, and that it may be caused by problems with the controls of transcription, at least one of the TGF-beta and WNT signaling pathways. Thank you very much.